Is there a shortage of licensed technologists in BC? And if not, why are some clinics still using unlicensed technologists?
Well, I'll speak from the medical radiation technologist perspective. Number one, there are no licensed technologists in BC. Licensed means they would be licensed by a college. We have certified technologists here in BC, and there may be in their numbers some people who are still writing the exam, the national exam, and have not yet been successful, and some employers might look upon that as if they've got a cost issue, they'll hire those people because they may be cheaper to hire. So again, there are no licensed technologists here in BC.
If I can add to that, I know that when I was actually going through school and I spoke to a cardiologist, he told me that once I got to a certain point in my education, he would hire me at a substantially lower rate to start working in his clinic long before I'd even written the exam. And that type of stuff is going on out there. So that's something I think we need to be looking at and making sure that if you go into a cardiologist's office, I think most of them do employ properly trained people, but I do know there are some that there is not that proper training. And that's something I think we need to address.
Michael, if I can touch on that too. A lot of the information that we get is more anecdotal, quite frankly, in terms of any shortages that are out there. And this comes back to having the ability to do some effective human resource planning in the long term. And we don't feel that any of the ministries and any of the healthcare authorities right now necessarily have the information that they need to make those kinds of decisions. I happen to serve as the chairperson of the advisory committee at BCIT for the Medical Laboratory Technology Program. And I heard just last week from industry people sitting around that table, there's a significant shortage of technologists, particularly in the rural areas of British Columbia. In fact, there are some areas in British Columbia, in the rural areas, that have had openings for a year or 2 years and have not been able to fill them at this particular point. So, I mean, but how can you do any effective long-term human resource planning when you really have no idea of the number of individuals that are actually out there in the profession? And because we are all voluntary organizations sitting around the table and there's no mandatory membership for any of these groups, we have absolutely no idea how many technologists there are out there, and quite frankly, not necessarily even a good idea of how many will be required down the road. If you look at some of the numbers that have been produced by our national organization, by CSMLS, they are predicting that up to 50% of our technology workforce across Canada could be eligible to retire in the next 3 to 4 years. Now, that's could be. They may not necessarily retire, but they could be available, or they could be eligible to retire within that kind of time frame. Just think what kind of impact that might have on the workforce if all of a sudden 50% of our workforce across the province were to disappear into retirement. And that's certainly a concern for all of us. But what we're seeing out there are shortages of individuals, of trained technologists in the system. We don't have the ability to deal right now effectively with internationally trained technologists in the system. Clinical placements in the healthcare system across the province are a huge, huge issue to ensure we have an adequate supply of technologists coming into the system in the long term. So there's a lot of major issues out there that need to be dealt with in a more effective, more coherent, more pragmatic kind of way than what we're dealing with them right now, which is just by guess and by golly. And we feel that having a regulatory structure will go a long way to addressing these issues along with a whole bunch of others at the same time.